This is Brian Law reporting live from the North York Civic Centre in Toronto, Ontario, and the first day of the swine flu vaccination propaganda campaign that started last spring with the outbreak of an unknown virus.
This is a new flu. It's only just recently emerged, but you may know that flu has 8 genes. And it turns out that 6 of those genes came from viruses that were almost certainly very closely related to other viruses found in pigs in North America, whereas 2 of its genes came from swine viruses found in Eurasia that hadn't previously been found else other than in Eurasia, certainly not in North America. But then we went on and had a look at them in more detail, because what we noticed was that each one of those 8 genes, instead of just evolving at roughly the same sort of rate as all the genes related to it, they had actually speeded up at some time in the past before we got them. The ones that are in the new flu have been going along at about 3 times the rate of those in influenza. And it's not just one of them, it's all 8 of those genes, including the 2 from Eurasia. So you have to sort of think now, how could that have occurred? And so we've been putting our mind to the ways in which it could have occurred. And one of the simplest explanations is that it's a laboratory escape.
This strain of swine influenza that's been cultured in the laboratory is something that's not been seen anywhere actually in the United States and the world. So this is actually a new strain of influenza that's been identified.
I think the real story here that people should be looking into is the claims of this virus being man-made. Why would people want to manufacture a virus? And why is it that everybody has listened to the media and been swooned by fear and propaganda to come down here today and get a shot that may or may not be good for them? And as you can see, there's a lot of children, there's a lot of elderly people in the lineup. These are called the priority. How long have you been waiting here today to get the swine flu vaccination?
I actually just got here now, but it looks like it's going to be a good 2 to 3 hours that I'll be sitting here with little Ella, who's only 7 months.
I've been waiting in line only about 20 minutes, and we came down because mass hysteria among social friends, I suppose.
We got here around 10:30.
And it's about 11:30 now, so you've been waiting in line just over an hour?
An hour, yeah.
Oh, I've been in line for nearly an hour, and I came down because I'm a diabetic, I'm heart condition, and I'm a high risk. I came down with my grandchildren because they're all asthmatic and they're high risk.
When you have a baby, right, if you don't get the shot, then the 1 in a million chance that something could happen, you feel bad.
I came here at 10 o'clock this morning, and I'm in one of the at-risk groups. That's why I came this morning, today.
Do you plan to get the regular seasonal flu shot as well?
No, not today.
Cognizant of the fact that children are listed as priorities, I wanted to get my daughter vaccinated sooner than later. I know adults get 1 shot, children have to get 2, and the longer, the sooner you get it done, the better, was my thinking.
Are you planning on getting the regular flu shot?
Good. That's a good question. I've avoided it every year to this date. Now I may get it.
Every year for the flu shot, I don't want to take it, but this time I was scared. I want my kids to take this shot.
So you don't usually get the regular flu shot?
Yes, but this time I think I will do this. I will take this shot. Because I was scared. I checked a lot of information about H1N1. I was very scared.
And what was the reason you decided to get the swine flu shot?
Because it's necessary.
Did you hear about it on the media first, or was it?
The media, city, I've heard it everywhere. It's just too many people getting sick and dying from this. It's just, it's out of control.
Yeah, I think with the recent death that took place a couple days ago with the 13-year-old boy who is pretty much healthy has concerned a lot of people. And I don't want to take the risk with her health. So, yeah, the media does play a part in this for sure.
Do you think they're blowing out of proportion the swine flu as opposed to the regular flu, considering the regular flu kills hundreds of thousands of people every year?
I think I have to agree with you on that one. I think it's because it's new. And there wasn't a vaccine for it before, and I think that's concerns that people are really scared as to what's going to happen. But the media, I think it scares a lot of people into thinking the worst. I think if it wasn't for all the media, you wouldn't have the lineup that you have today, right?
I think they're getting the media excited, so we're all rushing down here to make sure we don't die.
A lot of people die from the seasonal flu every year, but they typically tend to be older and have weakened immune systems, typically, whereas the swine flu seems to be affecting otherwise healthy people, and I think that's what's scaring people.
Do you think that fear is what drove you down to get this particular?
Good question. Yeah, there's definitely an underlying fear. I know we were away on the weekend, and a lot of my relatives' kids were sick. They had high fevers, and this was in the Ottawa Valley. I know that a girl unfortunately died from Cornwall. She died in an Ottawa hospital this past week, and of course the tragic case of the 13-year-old hockey player dying prompted, say, action that was more rapid if those events hadn't occurred.
And have you looked into what kind of stuff is in this particular vaccine that makes it different from the others, the ingredients, so to speak, in the vaccine?
I'm not a doctor, but I haven't. But I just placing all of my trust into Health Canada. Just blind trust.
Good afternoon, everyone. I'm David McEwen, Medical Officer of Health for Toronto, and I'm joined by Dr. Barbara Yaffe, Associate Medical Officer of Health and Director of Communicable Disease Control. I'd like to give you a brief update on our efforts to provide H1N1 flu vaccine to people in Toronto. This morning, we are here at the opening of our first clinics for high-priority members of the public, people who are in those priority groups that are at increased risk of serious illness in the event that they are exposed to influenza, to the H1N1 flu strain. We did have some heightened awareness, I think, in the past few days and increased demand for the vaccine, such that we've had a number of people show up early before the clinics were open. We also had some members of the public come to clinics which were intended for healthcare workers. Now, I'd like to urge members of the general public who are not part of the priority groups to be patient and wait until Monday when the 10 clinics open. We'll be in a much better position to provide a vaccine to them at that time. We really want to focus on getting those members of the priority groups immunized and protected as early as possible in view of the increased circulation of H1N1 virus around the community. Now today, here at North York Civic Centre, we've had a very big response. We've seen some long lineups. I'm going to advise members of the priority groups not to come to North York at this point. We're not going to be able to handle any additional immunizations. And in fact, I've just been consulting with the nurse managers who are operating the clinic. We have laid on additional staff to try and handle as many people as we can, but we have taken the decision that we will have to close the lineup at this point. There are enough people in line that we can handle. We're not going to be able to handle any more than that at this point.
Looking at the lineups now, there are reports that there were fighting skirmishes or fights. In hindsight, do you think that Toronto Public Health ought to have opened more clinics on a day like today?
Well, first of all, let me say that the line has been very peaceful. I think people are understanding of the situation that we're in. Everyone's keen to get their vaccine, but the line has been very peaceful. What we're seeing in Toronto is a mirror of what we're seeing across the country. There have been long lineups as the demand for vaccine increases. We have enough vaccine for everyone who's in line here today. We'll be monitoring the vaccine supply very closely over the next few days and weeks. It's being delivered to local health units like Toronto Public Health on a weekly basis, and we'll set our vaccine clinics accordingly.
So is that the reason then, is that you're getting the vaccine in doses, so if you were to open, you would run out? At
some point, the vaccine supply would be the limiting factor. Well, I think you have to understand that this is a new situation that we're in. The scale of the effort to try and immunize a large proportion of people in Toronto is unprecedented. This is a global effort to try and reduce the spread of H1N1. And the level of interest in the vaccine has gone up very sharply in the past few days as a result of reports of increased circulation of the vaccine and some deaths of healthy young kids. Well, we have cut back in a number of program areas over the next 6 weeks. in order to put on these clinics. It's a major effort. This is something that's being faced right across the country, where public health agencies at the local level are diverting resources from other programs in order to deliver this vaccine to members of the public. Remember, H1N1 is an illness which for most people will be a mild illness. I understand there's been heightened awareness and concern because of some cases of severe illness, but they are quite rare, and it's important for people not to dislocate their lives unduly as a result.
There's over 1,000 people here lined up to get their swine flu vaccination. You wouldn't see a lineup like this for the regular flu. What we are dealing with here is a product of propaganda, people feeding fear into the news on a constant basis. If you hear the same message over and over and over again, no matter where you hear it from, if you hear it from friends, you hear it from the news, you hear it on the radio, you read it in your newspaper, you'll be afraid not to get it. This is exactly what Edward Bernays talked about in his book, Propaganda. This is the collapse of our culture. This is the collapse of our way of life. This is the collapse of Canada and of the US and of the rest of the world into this new world order type system where people believe that if they don't listen to what the mainstream media and what the television tells them, that they're going to be at risk. So I guess we'll see as things progress whether this shot is going to be the cure or whether the shot itself is the pandemic.